Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for skin care for your baby. Tip number 1. This tip is about bathing. Your baby only needs to be bathed 2 to 3 times a week. Bathing your baby more than that can cause dry skin. So here's what you'll need. You'll need water. You want to fill a plastic tub with 2 to 3 inches of water, and you want to make sure the water is no more than 120 degrees Fahrenheit. You can test the temperature to make sure it's not hot using the inside of your wrist. That's a good way of checking the temperature is not too hot. Equipment you'll need is a large plastic wash tub, a cup, a washcloth, a baby towel with a built-in hood, baby shampoo, mild soap such as fragrance-free Dove or Cetaphil cleanser. And here are the instructions. So you'll prepare the tub with the warm water, 2 to 3 inches. Place the baby in it. Make sure the room is warm. Keep using the cup to pour water over your baby because most of your baby will be outside of the water. The reason you only use 2 to 3 inches is to prevent your baby from the baby's head being under the water. Use a soft washcloth to wash her face and hair. And after bathing, pat her dry. It's important never to leave your baby alone, not even for a second, while she's in the bathtub. Tip number 2 is diapering. So choose a diaper, either cloth or plastic, or disposable, and you should be changing your baby's diaper about every 2 to 3 hours, which is about 10 times a day. And 2 to 3 hours is about how often she urinates, so that's why it's a good frequency to change the diaper. The equipment you'll need are diapers, a small basin with lukewarm water and a washcloth, soft paper towels or cotton balls. An alternative to the soft paper towels and cotton balls is a commercial, like a store-bought, alcohol and fragrance-free diaper wipe. So no alcohol and no fragrance if you buy wipes in the store. And because wipes often will cause irritation, you should stop using them and go back to soft paper towels and cotton balls if your baby's skin becomes irritated with wipes. When you're changing your baby's diaper, using soap is not necessary. But if you desire to use something, you can use fragrance-free Dove or Cetaphil cleanser. Both are mild to the baby's skin. You'll also need a diaper ointment or petroleum jelly. Some of the more common brand names are Desitin, Triple Paste, A&D ointment, Balmex, and Vaseline. So here are your instructions. First, remove the dirty diaper. Use lukewarm water and the cotton ball or the soft paper towel to gently wipe your baby clean. So you're using the disposable stuff, either the paper towel or the cotton balls, to clean off the initial feces and urine. Make sure when you're wiping girls in there that you wipe from front to back. And you should avoid scrubbing too hard or being too overzealous in your wiping your baby to avoid skin irritation. After you've used the paper towel or the cotton ball that's been damp, then you're going to use a washcloth after you've cleared up the major dirt, feces in urine. Then you're going to use a washcloth to wipe the diaper area. And you should ideally allow the baby's skin to air dry. After the skin is air dry, apply the diaper ointment or the petroleum jelly. And again, just like with bathing, it's important never to leave your baby alone, not even for a second. Tip number 3 is clothing. Baby's skin is particularly sensitive, especially in the first few months. And if you're using any new clothing on your baby, or you wash clothing with harsh detergents, this can be a cause of irritation to your baby's skin. So it's recommended that you double rinse all of the baby's clothes, including bedding and blankets and any other washable items. And for the first few months, you should do your infant's wash separately from the rest of the families. Tip number 4 is breastfeeding. I recommend breastfeeding in many of my videos as prevention for almost and a healthy tip for many different reasons. For skincare, it's actually been shown to decrease the number of diaper rashes babies get. The reason is not exactly sure, but it is a fact. So I do recommend as tip number 4, breastfeeding all infants. And for this video, the specific reason is to lower the risk of diaper rashes. Tip number 5 is to avoid direct sunlight on your baby. Especially in the first 6 months of life, your baby's skin is extremely sensitive to sun. And getting sunburned early in life leads to an increased risk of skin cancer as an adult. So it's very important to keep your baby out of direct sunlight, but it is recommended that you do not use sunscreens for at least the first 6 months of life. Tip number 6 is nail care. So you should trim your baby's nails, and in the first couple of weeks it might be twice a week to keep your baby's nails short. The best way to do it is with a soft emery board, otherwise called a nail file. The fingernails should be kept short and smoothly trimmed, as smoothly trimmed as possible to keep your baby from scratching herself and scratching you. Tip number 7. So I've given you tips about how to care for your baby's skin. If your baby's skin does become dry, then you can use a fragrance-free, hypoallergenic moisturizing lotion on your baby's skin. It's a good idea to apply this lotion immediately after you give your baby a bath to keep in moisture. If the dryness persists, then you may be bathing your baby too often. If that's the case, give your baby a bath just once a week for a while. Tip number 8, if a diaper rash develops. So if a diaper rash develops on your baby, you can begin using an oil-based barrier ointment. I gave some of the brands above: Desitin, Triple Paste, A&D ointment, Balmex, or Vaseline. This will prevent further irritation from urine and stool. And make sure you're changing your baby's diaper as frequently as necessary to keep your baby's skin dry. If your baby has developed a rash and you've tried these things and it hasn't gotten noticeably better within 48 to 72 hours, then it's important for you to consult your healthcare provider, whether that be a pediatrician or a family practice doctor. Tip number 9, if your baby develops acne. So if your baby develops acne, pimples breaking out on her face, sometimes on the back too, it usually happens at 4 to 5 weeks of life. And it may be made worse if your baby lies in sheets that have been laundered in harsh detergents, or that your baby has soiled by milk that she spit up. So what you should do is place a soft, clean blanket under her head while she's awake, and wash her face gently once a day with a mild baby soap to remove milk or detergent residue. And tip number 10 is to believe in yourself. It's an awesome experience to take care of a little one. And I've provided you with 10 basic tips to give your baby good skin and nail care. I hope these tips have been helpful. Thank you very much for listening, and have a great day.